In this video, we will be reviewing some ear disorders such as hearing impairment, conductive hearing loss, neurosensory hearing loss, the Weber and Rinne test, and Meniere's disease. We will be reviewing this by going over 5 different questions. I will read the question, pause to let you think for a second, then I will read the answers to you, and we will discuss. This is just a quick review on these topics. If you need more in-depth, please visit your nursing resources under neurological and/or the ear disorder chapters. Let's get started. Question number 1. The nurse is admitting a client that is hearing impaired with neurosensory hearing loss. When gathering the patient's health history, what approach is best? Take just 3 seconds and see what you remember about neurosensory hearing loss. Would it be to number 1, speak into the impaired ear, number 2, speak louder, number 3, request a sign language interpreter, or number 4, ask if hearing aids are in and working? The answer here is number 4. Whenever the question is asking what approach is best, always consider maybe there's some assessment to gather first. And in neurosensory hearing loss, the problem is actually damage to that 8th cranial nerve, which is the acoustic, or you might call it the vestibulocochlear nerve. And so by simply speaking louder or speaking into the impaired ear, that's not going to help at all. And they might not know sign language. So first, you would want to ask if they have that cochlear implant, and you can see that pictured in the slide here. It has that little attachment to the back. And you want to make sure those are working. And then it would help to also speak slowly, pronounce your words, reduce other noise that's around, and if they do have a good ear, definitely speak towards that ear. But the most important thing to remember is they can't hear you if they don't have their cochlear implant in. It's a good idea to make sure that you understand the different types of hearing impairment and make sure you know how to communicate with them. For example, the other type is the conductive hearing loss. And that one does not have anything to do with the nerve. It has to do with just sound, not being able to get through the ear. So maybe it's blocked by cerumen, which is just a fancy word for wax, or there's ear infection in there, or maybe fluid. Or it could also be where the little bones in the ear, the stapes, they're just not working well, and that's called otosclerosis. So for that one, you would want to see what is causing it, try to fix that, and if you can't, those are the ones that wear the hearing aid. And finally, there's this other type of hearing issues, and that's in older adults. It can just happen over time. It's called presbycusis. And that one is when the older adult can't hear high pitch anymore. So when you're communicating with an older adult with presbycusis, again, make sure you're speaking slow and pronounce your words, but also try to speak in a lower voice, and then they can hear you better. If you're high pitched, they won't know what you're saying. Question number 2. A client with conductive hearing loss is wearing his hearing aid, but states he cannot hear anything. What should the nurse do? Would you, number 1, ask the client to turn on his cochlear implant? Number 2, notify the doctor that the patient cannot hear? Number 3, check the hearing aid batteries? And number 4, speak louder to the patient? The answer to this question is number 3. This implies the word do, and do means what action will you take, and the nursing process, clinical judgment, always says to assess first. So you would want to be looking in the ear to see if there's anything obstructing the sound. Remember, this is conductive hearing loss, so the sound isn't getting through for some reason. And if you don't see anything blocking the ear tunnel itself, then also check the hearing aid. Maybe it's not functioning, or maybe the battery is dead. So in this question, if you had a hard time with it, make sure that, again, that you focus on your assessments first. And in this case, it's to see exactly why sound might not be traveling into the ear. Number 3, a client is complaining of not being able to hear in his right ear. The nurse does the Weber and Rinne test. What technique is correct? Do you remember these tests? If you don't, there's a short video at the end of these questions to help you with that. Is the answer number 1? The nurse performs the Weber test by striking the tuning fork and touching it behind the patient's ear. Number 2. The nurse performs the Rinne test by striking the tuning fork and touching it behind the patient's ear. Number 3. The nurse performs the Weber test by striking the tuning fork and touching it to the top of the patient's head. Number 4. The nurse performs the Rinne test by striking the tuning fork and touching it to the top of the patient's head. This is just a content question. It's really just about the skill of the Rinne and Weber test, if you remember. So the thought should have been that the Weber test is when the nurse strikes the tuning fork and places it at the top of the patient's head and asks them which ear they hear it the loudest. The Rinne test is when they strike the tuning fork, place it at the behind the patient's ear, and when they stop hearing it, they should signal the nurse, and then you move it to the front of the ear and ask them if they still can hear it. So that's a bit wordy, but the answer is number 2. The nurse performs the Rinne test by striking the tuning fork and then touching it behind the patient's ear. That is the first step in the Rinne test. Number 4. A client is status post a stapedectomy for conductive hearing loss associated with otosclerosis. Upon return to the unit, what should the nurse do first? So it's important to note that they're post-surgery. In these questions, always pay attention to whether they're pre-surgery, in the surgery, or after the surgery, because your nursing responsibilities are going to be different depending on what part of the surgery is going on at this point. So in post-surgery, would you, number 1, check the bandage for bleeding? Number 2, lie the patient with his surgical ear upright? Number 3, ask the patient his pain level? Or number 4, notify the doctor that the patient has returned to the unit? The answer here, again, is to focus on that word do. Do is a synonym for the word action, and I need to be thinking about the nursing process, and good clinical judgment says that I should assess first. And Maslow also says that the most important thing to assess for is physical issues that could be a complication, and in this case it's post-surgery. So I'm thinking I want to check his bandage, I want to make sure he's not bleeding when he comes back to me, making sure that's okay, and therefore number 1 is the answer. Number 2 is not wrong. We do want to lie the patient with a surgical ear upright, but the most important thing is to assess first. So make sure to review the most important signs and symptoms, the most important assessments, post-surgery, again, are important for the nurse to know. Number 5, a client with Meniere's disease is experiencing severe vertigo. Which instruction would the nurse give to the client to assist in decreasing the vertigo? Would you, number 1, avoid turning the head quickly? Number 2, lift the head of the bed semifallers? Number 3, increase sodium in the diet? Or number 4, take diuretics as ordered? The answer here is number 4. In order to decrease vertigo, we need to remove the fluid. Meniere's is defined by the accumulation of endolymph, which is ear fluid. In this video, it's a quick reminder of how to do the Rinne test. So in order to do this, strike the tuning fork, place it behind the ear. When the patient can't hear it anymore, then they should signal you. Then you move it to the front of the ear, and when they can't hear that anymore, they signal you again. And make sure you note the length of time. And then in the little chart here, it tells you the results. If they hear it longer when it's in front of the ear than behind the ear, that is good. That is normal. If they don't, that is considered conductive hearing loss. Sensorineural might give you a false positive here, making you think it's normal. So this test isn't the best for sensorineural hearing loss, but it's a quick check to see if maybe this is conductive hearing loss. The Weber test is a little bit easier. It's just 2 steps. You strike the tuning fork and you put it right in the middle of their head. If they can hear it on both sides equally, that's normal. If they hear it louder in that bad ear that they're complaining of, that is conductive hearing loss because sound moves quicker through solid material than air. If they hear it louder in the good ear, that's a sign of sensorineural hearing loss. So hopefully that helps you with your Weber and Rinne test. If you like the information here, subscribe to our channel for more, and you can always find us at signstrategies.com.